For your hand or elbow surgery at Musgrave Park Hospital, you'll have been offered a nerve block. A nerve block is an injection of local anaesthetic around the nerve supplying a particular area, which will lead to numbness of the part of the body having surgery. This is an effective type of regional anaesthesia and pain relief, which can be used instead of a general anaesthetic. An anaesthetist will have a brief discussion about your general health, medications you're on, and allergies that you have. An anaesthetist will explain in detail the process of having a regional anaesthetic nerve block, an injection, and advantages and risks associated with this technique. The advantages of a regional anaesthetic include excellent pain relief, with fewer painkillers and no morphine required. It avoids a general anaesthetic with its associated risks. It also allows a quicker and pleasant recovery for patients getting home earlier and higher patient satisfaction. It's also much safer and more preferable in high-risk patients. A nerve block provides excellent pain relief both during and for many hours after the surgery. It avoids side effects of morphine. These include nausea, vomiting, itch, confusion, sedation, and others. Furthermore, it avoids the need for a general anaesthetic, which can often cause sore throat, hoarseness, sickness, drowsiness, and a longer stay in recovery. A general anaesthetic is also associated with breathing difficulties and cardiac problems, which can be avoided by using this nerve block technique. A surgeon will also meet you on the day of surgery. He or she will go through the operation, explain to you the procedure, and will also mark the relevant arm that is getting operated on and get you to sign a consent form. The ward staff will accompany you to theatres. Nerve blocks are carried out in the specialised blockroom area of the recovery ward, which is close to theatres. When you arrive, the anaesthetic team will apply some monitoring and perform routine safety checks, which will include double checking your details and your consent form for the planned operation. An intravenous cannula will be sited into the hand which isn't getting operated on. The skin around the planned injection site will be cleaned with an antiseptic solution. This will feel cold. An ultrasound probe will be used to identify the particular area underneath the skin where the nerves can be injected around. The skin will be frozen with some local anaesthetic before the needle is advanced. A nerve stimulator is sometimes used, which can feel like a gentle twitching when the tip of the needle approaches the nerve. Once the injection is complete, you may notice some tingling and warmth in the blocked area until it becomes quite numb and weak. Are there any side effects to having a nerve block? Commonly there may be a small bruise at the injection site, but this subsides after a few days. Uncommonly, there could be a patch of prolonged numbness or tingling that persists for a number of days or even a week after the injection. On very rare occasions, this could be a permanent feature. There are potential complications involving the heart or the brain with the injection, but this is extremely uncommon, and the staff here are very well trained to recognise and treat this if it were to occur. Your anaesthetist will come back and check how well your arm is blocked and numb, testing of the block. Occasionally, a supplemental nerve injection can be provided around the elbow if the area needs to be further numbed. Once in the operating theatre, you'll be positioned so that you're comfortable. A drape will be placed between you and the surgeon so that you won't be able to see your operation. Bring a personal music player or a tablet and a pair of headphones so that you can have your own entertainment during the operation. A member of staff will be present with you throughout the operation in case there's anything you need. During the operation, it is usual to feel some movement, but you shouldn't feel any pain. If you do feel discomfort during the operation, either the surgeon can give more local anaesthetic, supplemental sedation, or in other cases a general anaesthetic can be given. After theatre, you'll be getting ready for discharge. Your arm will be numb for several hours, so you'll be given written instructions about how to protect your arm until the feeling and movement returns. You will also be supplied with some painkillers with clear instructions on how to use them. It's important you start taking them before the nerve injection wears off so that you can remain comfortable as your recovery continues in the comfort of your own home.